Well, my role is to provide senior clinical advice and support. Having worked at the university hospital, I know the processes there well, and my role would be to integrate the processes here into the processes at UHNS to ensure that patients get an equitable service between Stafford and UHNS, so patients don't get a bad deal if they come here. They would get an equitable service, and we would correctly identify those patients who can be treated here safely and those patients who need to go to the UHNS for further specialist care. Yeah, I think the thing that's most important about it is early identification of what the clinical condition is, and that's important. That's the role of the emergency department, to identify the patient, the clinical condition of the patient properly, and then we can plug into the most appropriate service, be that at Stafford or if it's a transfer to Stoke if necessary. The most important thing about having a site at Stafford providing high quality care is that it unburdens the emergency department and the services at Stoke, and only the appropriate patients would need to go to Stoke. And that's obviously a win for the local population because they wouldn't need to travel if it wasn't necessary. I mean, what we would do is we would try as much as possible to have staff work across both sites. So essentially, the service that we provide is equitable. We've had issues in the past where patients might feel underconfident about perhaps coming to the Stafford Hospital because of issues we've had in the past. I think the most important thing is to reassure people that if they present to Stafford Hospital, they will get an equitable level of service, and they would only be transferred to Stoke if absolutely necessary.